Greetings and welcome back to a Health Talk with Lisa, where we talk about all things holistic health, mind, body, and spirit. I'm your host, Lisa Thomas, and today we are diving into a topic that might make you giggle a little, but trust me, it is one that is worth listening to. So let's talk about what your urine says about your health. Yep, you heard it right. Your pee is like your body's daily report card. So let's start with color. So ideally, urine should be light yellow. And I don't know if how many of you actually pay attention to the color of your urine, but you should. Because a lot of times when people use the restroom, they just kind of, get in there, use the restroom, and they get out of there. But you really should take a look at what your urine looks like, just like you should take a look at what your BMs look like. But today we're going to just talk about your urine. Your urine should be light in color, just like lemonade, because that means that you are hydrated and that your kidneys are quite happy. But if your urine is dark yellow or even amber in color, then that means your body is saying to you, hey, I need more water. And if it is pink or red, then that could mean that there's blood in your urine. And that's when it's probably time for you to call your healthcare provider. But don't panic. Sometimes, if you're eating foods such as beets or a great deal of berries, that can, cause your urine to change, into that color as well. But let's be real. How often are you really eating beets or eating a whole lot of berries? And then here's something else you probably need to think about too. If your urine ever looks green or blue, then just know that it's most likely not your superpowers showing through. It could be, indicative of, you know, uh, perhaps medication or even a food dye. So just kind of keep that in mind. So I want to, I'm going to talk about, I'm going to break this down into color, odor, clarity, frequency, and volume. And then I'm going to look at some of the urine testing insights. So again, as we look at color, if your urine is pale yellow to amber, this is normal, healthy hydration levels. Okay. If it's clear, then you may be overhydrated. For those of you that like to drink gallons of water, just know that you only should be drinking half of your body weight, and you should increase your water intake if you are exercising and burning more fluid, losing more fluid, or if you are, working and at your place of business, say perhaps you're working outside and in the heat, and that causes you to lose, more fluid, then yes, then you need to increase your water intake at that point. But clear liquids, that's, clear fluid, clear urine, may be that you're overhydrated. So too much water now can dilute your electrolytes, and you need your electrolytes. Now, if your urine is dark yellow or amber, again, you may be dehydrated. So at this point, you need more fluids. Also, if your urine is orange, this could be also due to dehydration, and it also could be that you may be taking a certain medication, such as rifampin, or you may have an issue with your liver or your bowel duct, and that can be causing you to have this orange-like color. Also, if it's pink or red, this could indicate that there's blood in the urine, also known as hematuria, which could result from urinary tract infections, which are UTIs, This also could indicate that you may have kidney stones, or this could even be a more serious condition. And then, like I mentioned before, beets, if you eat beets, or if you eat a lot of blackberries, this can cause this. And then, what if your urine is brown? This again could be a possibility of severe dehydration, which is not good. And this could also indicate that you have liver disease, or perhaps, certain medications can be causing this. But again, this is the time for you to be really speaking to your medical professional at this point. Okay. And then again, if it's green or blue, this is rare, but it can occur. And again, this could be due to dyes, certain dyes, medications, or this could also indicate, infection. Alrighty, so now let's look at the odor. So now we have the smell test. Now, normally urine has a mild odor, okay? But if your urine smells strong or has this ammonia like smell, then this could be an indicator that you are dehydrated. But what if your urine has this sweet smell or a fruity smell? Now, this could be a clear indication that you may have a very high blood sugar content, or you may have diabetes. So this is something that, if you're unsure about it and you have not been diagnosed with diabetes, then you will want to go and get that checked to see if see if you have diabetes. And what if you have a foul odor? What if your urine smells really foul or fishy? Then this could be an issue, such as an infection. But one thing about it, if you smell it, then you're smelling correctly. Okay, so that means it's something that you need to investigate. So again, to recap, a mild odor is normal, but a strong ammonia smell, this is often linked to dehydration or concentrated urine. Sweet or fruity smells may be a signal of uncontrolled diabetes or even a ketone buildup, for those who may be putting their bodies in ketosis. So this may be, this will also show up in your urine. And then also a foul smell could be an indicator of a UTI or a bacterial infection. So that's odor. Now let's look at clarity. Now, with clarity, this is what your urine looks like, okay? So clear urine, urine that you can see through, right? This is great. This just shows that you have balance, right? But what if your urine is cloudy or if it's foamy? Then this may be a signal that you may have an infection, or that protein may be leaking into your urine. And if you have protein leaking into your urine, this could be a sign that your muscle is breaking down. This is very scary, and this is dangerous, because now that means your kidneys need some attention, and they need attention very quickly, because this is not good for you to be leaking protein. All righty. So clarity, if your urine is clear, this is normal. Cloudy could indicate infection or perhaps kidney issues. What if you have pus in your urine? Okay, again, infection. Mucus. What if you have mucus or crystals? This again, infection. But what if your urine is foamy or bubbly? This persistent foam, especially with the males, This may be a sign of protein in the urine. So for my bodybuilders or my people that like to go to, go to the gym a lot and eat nothing but a lot of protein, be real careful about this over consumption of protein because you could be causing the overworking of your kidneys. Your kidneys can't process all of that, and some of it will start leaking out into your urine. Okay, so be real mindful of that. Now, let's look at frequency and flow. Now, how often you go to the restroom to relieve yourself matters, right? So you have to think about this here. How often are you going? Could it be that you're drinking too much coffee? Is it that you're pregnant, or do you have diabetes? Or because your bladder can hold about 500, a little over 500 milliliters of urine. Are you drinking a lot? Are you drinking more than enough? So that will cause you to go a little bit frequently, right? But if you have, if you're pregnant, then we can understand the frequency, right? Because of, the baby, is sitting probably sitting on the bladder. And then diabetes causes polyuria. So that's frequency in urination. For our guys that may be over the age of maybe 45, 50, they can have, nocturnal urination where they're getting up and going to the restroom quite often. This could be a sign of prostate issues. So think about it. If you're going to the restroom a little bit more than usual, then you probably want to kind of look at the situation and kind of try to identify why. But what if you're not going enough? Well, then you'll have to look at, could I possibly be dehydrated? Okay. Because if you're not going enough, then you're probably not drinking enough, and you're probably not putting in the right vegetables in your body either that contains fluid. So your body is always sending the signals, it's always sending the clues. You just have to make sure that you are paying attention to it. Because one of the things you do not want to do is to find yourself so dehydrated to where you become delirious. You can, and that is a possibility. You can become so delirious, and then you find yourself being in the hospital and needing bags of fluid. Okay. So make sure that you're drinking enough fluids and water, especially water. You don't need all the sugary drinks because that's not good for you. But make sure you're drinking enough water because your cells need it, your tissues, your bone, your organs, your brain, your everything needs water. Okay. So make sure you're drinking enough water. And again, you should be drinking half your body weight, and then you drink more if you are, burning and losing more. Okay. So, frequent urination may be due to high fluid intake, such as caffeine, pregnancy, or conditions such as diabetes or UTIs, urinary tract infections. Infrequent urination can result from dehydration or kidney issues. Excessive volume, such as polyuria, may be indicative of diabetes or a hormonal imbalance. But then, if you have the low volume, um, this could point to dehydration or perhaps even a kidney dysfunction. And if you're having a kidney dysfunction and you're not going enough, then you may also see perhaps swelling in your lower extremities, in your legs and your feet. So this is not good either. So eating a high salt diet does not help with this either. So that can also be, a strong indicator that your kidneys are not functioning properly either. So again, you will want to consult with your physician very quickly. So what do we do as far as testing insights? Well, let me share. So we often check patients for glucose. especially if they have the sweet smelling, fruity smelling urine. And then, of course, that's part of your BMP lab testing that is done in the office, basic metabolic panel or a comprehensive metabolic panel. And so we check for glucose because we need to make sure that the patient don't have diabetes. So if we suspect glucose, we check that. We can do a urinalysis, and that can check for glucose as well. Inside of the urinalysis, we can check for protein. If we see protein in the urinalysis, that can signal kidney disease. Okay. Um, Again, the kidneys is now leaking protein into the urine, so which is not good at all. Also, inside the urinalysis, we can also see ketones, which is very common with diabetes or individuals that are fasting or on these fad diets. Um, where you're starving yourself. This is not good. I tell people all the time it's not good to throw your body into ketosis. So it we can see the elevation in the ketones inside of the urinalysis. Also, we can check inside of the urinalysis bilirubin and bilirubin. And this can also let us know that a person has liver problems if these numbers are, you know, um, are abnormal. Also, we can see is out of a urinalysis leukocytes or nitrates, which could suggest that a person has a UTI. Okay, and then we can also see whether or not a person has blood in their urine just by looking at just a basic urinalysis. Okay. And of course, there are other detailed testing that we can do as well. So, again, I can tell a great deal just by looking at the at your urine, and you can do the same. You can do the same just by looking at your urine, looking at the color, smelling the odor, looking at the clarity, looking at how frequently you're going, looking at the flow of it, and then this can give you a really good idea of what's going on with you on the inside. So just know that how often you're going and what your urine looks like, what it smells like, all of that matters. So we're looking at everything. And just like we can take your blood and to identify things that's going on in your body, we can do the same thing with your urine. So I would say pay attention. Pay attention because it's we don't know what's going on with you unless you let us know what's going on with you. Okay. And so it's going to be for you to pay attention to your body. Your body's going to tell you if something is going on. Okay. So the next time you head to the bathroom, just take a quick peek. Your body might be telling you something very important. So until next time, thanks for tuning in to Health Talk with Lisa. If you enjoyed this episode, share it with someone who loves learning about health the natural way. And until next time, stay hydrated and stay holistic. Take care.